Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. The number of confirmed cases of COVID-19 in the nation continues to grow. In North Carolina, there are 185 reported cases in 36 counties, which includes Hyde County. Medical providers in Dare County continue to test patients who meet criteria for testing, which includes fever of 100.4, cough, and symptoms of respiratory illness. We have not had any individuals test positive for COVID-19 in Dare County. When we do have a positive result, we will share that information as soon as possible. Dare County is working hard to protect its residents. The county's control group has implemented restrictions that prohibit visitors and non-resident property owners from entering the county. The state has also implemented mandated restrictions for restaurants and bars, as well as for mass gatherings. These are mandated, meaning they can be enforced by law. The measures being taken are unprecedented and geared to slow the spread of this disease and reduce the number of sick. I cannot stress enough how important it is for each of us to do our part by following the social distancing guidance and other recommendations for the protection of public health. Every single person in this county plays a role in helping reduce the transmission of the virus. Every day we are learning more about this virus and the disease it causes. One of the things we are learning is that although older people are the hardest hit, younger people are not spared. Data from the outbreak so far in the United States show that people under 50 make up a significant proportion of patients requiring hospitalization. Even if you don't get sick, the choices you make about where you go and what you do could be the difference between life and death for someone else. Practicing social distancing and limiting direct contact other than family members are critical steps we all should be taking. The reason social distancing and direct contact are such important mitigation strategies is because the COVID-19 virus is highly contagious and can linger on surfaces. A study released by the National Institutes of Health this week reveals that the virus stays on cardboard for up to 24 hours and up to 2 to 3 days on plastic and stainless steel. I'd like to take this opportunity to explain to you why it is recommended that we practice social distancing as a way to mitigate the spread of COVID-19. Let's take a look at the math behind social distancing. Robert Siner, assistant professor for medicine at the University of California, created a graphic that illustrates how social distancing works to prevent the spread of disease. As you can see, before social distancing, one asymptomatic person who doesn't practice social distancing can infect 2.5 people. And in 30 days with no social distancing, 406 people can become infected. An asymptomatic individual, which means someone with no symptoms, with 50% less exposure will only infect 1.25 people in 5 days. And in 30 days, 15 individuals will become infected. And finally, with 75% less exposure, 0.625 people in 5 days. And in 30 days, only 2.5 people become infected. Today, I am pleading with all Dare County residents to think hard about what you are doing on a day-to-day basis. And do any of your actions put you or those you're in contact with at greater risk for contracting COVID-19? For example, are you still participating in non-essential activities that require you to be less than 6 feet away from others for 10 minutes or more? For example, are you going to a gym or fitness center? Are you still going to the movie theater, bowling alley, or escape rooms? Are you still going to a nail or hair salon? While these are all wonderful activities, they are not essential services, and now is the time to be limiting direct contact unless it is an essential need. Dare County has taken great measures to protect our people, and it is up to the rest of us to do our part. We are all adjusting to this new reality because of the pandemic. For many, life has changed dramatically. During this difficult time, it is important to continue looking after your physical and mental health. This will not only help you in long term, but it will also help you fight COVID-19 if you get it. The World Health Organization recommends the following. First, eat a healthy and nutritious diet, which helps your immune system to function properly. Second, limit your alcohol consumption and avoid sugary drinks. Third, don't smoke. Smoking can increase your risk of developing severe disease if you become sick with COVID-19. Fourth, exercise. 30 minutes of physical activity per day is recommended for adults and 1 hour per day for children. Consider going outside for a walk, run, or a bike ride, and keep a safe distance, 6 feet, from others. If you can't leave the house, find an exercise video online, dance to music, do some yoga, or walk up and down your stairs. If you are working from home, make sure you don't sit in the same position for long periods. Get up and take a 3-minute break every 30 minutes. And fifth, look after your mental health. It's normal to feel stressed, confused, and scared during a crisis. Talking to people you know and trust can help. Supporting other people in your community can help you as much as it does them. Call and check in with neighbors, family, and friends. Compassion is medicine. Listen to music, read a book, or play a game, and try not to watch or read too much news if it makes you anxious. Get your information from reliable sources once or twice a day. I understand these uncertain times can lead to community members feeling anxious or fearful. As we move forward through this pandemic together, facts over fear is the best way we can all find comfort. We will continue to provide updates with factual information as we receive it, and we encourage you to stay informed by visiting www.darenc.com/COVID-19 or visiting the CDC or NCDHHS websites. If you have specific needs or questions regarding COVID-19, you may also call the Dare County Call Center at 252-475-5008. Thank you.